All right, let's take a closer look at the digastric muscle itself. This is a great graphic representation. What I want you to see here is the side view. This is looking at the right side, so this is the right digastric muscle. Remember, you have two. You have one on the right, one on the left. This is that posterior belly and the anterior belly, going from that mastoid notch to the hyoid bone and then to the chin. And this central tendon is this part right here that it attaches to the hyoid, and it's like a slingshot. This is an anterior view. If you tilt your head back up and you're looking towards the ceiling, this is that anterior part going from the chin. So when we show you how to slide your thumbs up underneath the jaw, that's what it's going to be like there. And what are the actions of this guy? Well, they will depress the jaw. That means open the jaw. So if you're a mouth breather like this, that muscle gets contracted all day long and it's going to get tense. It will elevate the hyoid. And that makes sense here too. Look at the hyoid. If this front part contracts and the back part contracts, it will pull up, elevate the hyoid. And it will retract the jaw. I mean, pull it back a little bit. And that makes sense too. If you shorten the anterior and you shorten the posterior, they'll pull the jaw backwards this way. I mean, you can see how that can really do a number on the skull itself, on the mandible itself, and on that hyoid. So what are some of the possible symptoms that you can have when there's an issue with the digastric, either the anterior or the posterior? And usually it's going to be both. It's involved with speaking, swallowing, and breathing. So you can have an issue with any of those. Difficulty swallowing, difficulty breathing, difficulty speaking, TMJ, jaw issues, jaw pain, jaw deviation, stuff like that. You can also have pain on the side of the neck right here where it's located, into the jaw, into the ear, into the back of the head, like an earache you might get as well. Lymphatic stagnation, because the largest lymph node in the neck sits right here, right where the muscle crosses to that mastoid process. You'll see the video coming up in a moment on that. And facial muscle tone may change. You may have more tone on one side than the other side because the posterior belly of the digastric muscle is innervated by cranial nerve number 7, and cranial nerve number 7 innervates the muscles of the face, so it's facial expression. So you may have something going on with that as well. I'm going to skip the anatomy and physiology for a second and go to possible causes. Well, one, you're a chronic mouth breather. Keeping your mouth open all day long will contract that muscle, get tense and get tight, and everything gets choked off. Whiplash trauma injuries from rear-ended, being hit from the side, being pushed from behind. It's called hyperflexion, hyperextension injury. You're stretching and shortening the fascia really quick. Trauma, punches, fights, assaults, chokes around here. People who do mixed martial arts, Brazilian jiu-jitsu, things like that. I see this a ton because they get rear naked choked and they have the compression on the throat, and it can compromise the hyoid bone and stuff up and through here, until you get the tap out on the mat. If you have the tongue at the floor of the mouth as opposed to the roof of the mouth, because your resting position of your tongue is supposed to be at the roof of the mouth, and if you're a mouth breather, you'll keep your tongue down below, and that's the floor of the mouth. So if you're tense and tight in this anterior belly, you can cause a lot of tension up underneath in the floor of the mouth where the tongue sits, and you can get some issues. Bruxism, grinding, tension at night when you sleep, or grinding if you're under a lot of stress and pressure. It can do that. I'm going to give you some contraindications, some precautions. If you have carotid artery stenosis, okay, I don't want you to be doing this type of stuff because you're going to be really close to the carotid artery and the branch points of the internal and external carotid. You can still do it in this region, but go easy. It doesn't take sledgehammer, huge pressure in here. And that's also why I don't want you to do both sides at the same time, because if you press too hard up in here and you're doing both sides at the same time, you can cut off blood flow to the head and you'll pass out and it'll go lights out. So you just do one side at a time on the posterior. You can do both at the same time in the anterior, but don't be scared of going in this region. Just go easy. Pay attention to how you feel. If you have severe pain at any time, I want you to stop. It should ease up. If you have difficulty swallowing now, I want you to go to your doctor anyway, because you need to check out trouble swallowing, because that's usually something neurological we need to rule out, make sure everything's okay with the brainstem and the throat. So make sure you do that. If you're doing anything in through here and you have trouble swallowing, I want you to stop, and I still want you to go see your doctor. Okay, so let's go to some anatomy and physiology stuff. You're going to see an anatomy app in a moment where I'm going to go through these bit by bit to show you lymphatics, arteries, veins, nerves, how they all interrelate to each other, and it's not just a muscle that you're releasing here. But we showed you before that the posterior belly is innervated by cranial nerve number 7. The anterior belly is innervated by cranial nerve number 5, branches of the trigeminal nerve, and that will affect your brainstem and what's called your pons. So let me show you what that means, because it probably sounds like Martian to you right now if you're not familiar with anatomy and physiology. This is a picture of your brainstem that's in the back here, but this is an anterior view of it from the front. It will become your spinal cord down below, and these are cranial nerves that come off the brainstem. Okay? You have the midbrain, pons, and medulla. We're going to pay attention to the pons, because the pons is where you have that trigeminal nerve that sits there that's going to be innervating that anterior belly, and you have the facial nerve, which is going to be innervating that posterior belly, right? Now, the trigeminal nerve does a lot of stuff, but it will primarily give you sensation to the face and innervate muscles of mastication, which are the temporalis on your temple, your masseter in your cheek, and the lateral pterygoids here. Make sure you go watch our lateral pterygoid Dr. Evil release reset video. You can help get a release into that one. Be quite nice, and it can be quite uncomfortable, just to let you know that, because it's typically a hot mess on a lot of people. And you can see how those in and of itself may cause jaw issues, but now you'll see it will relate to that anterior belly at the same time. And the posterior belly is going to be that facial nerve. So if you have issues with that posterior belly, you can change different things on the face. Now you'll also see the trigeminal nerve and the facial nerve sit next to a couple of other nerves there at number 6 and number 8 in the pons. So they can impact those nerves. What I'm telling you is that if you have an issue with the digastric, it can impact these other things. Now, the abducens nerve is a muscle that controls the eye. It's an eye muscle. The vestibulocochlear nerve controls the vestibular system and hearing. You will also see when we show you on the anatomy video, you're going to impact a lot of these other nerves. You're going to impact, when you do this region up behind the angle of the jaw, cranial nerve number 9, number 10, number 11, and number 12. So you're actually going to really stimulate the medulla at the same time because of where you're putting your finger. This is an absolute neurological powerhouse for you. Okay, so let's change the camera angle here, wrap this up a little bit. So what we're going to be doing and moving into now is the anatomy app to show you these things on really cool views. Then we'll go into showing you on a demonstration myself how to do it on yourself. And if you work with people and you're licensed to do so, then you can do it as well. Okay? All right. Let's move into the next part. Okay, let's take a little bit of a closer look at the posterior digastric. First thing to notice here is the point at the mastoid process, that's by the ear, and the attachment point at the hyoid bone under the chin. When you watch these self-release tension techniques, you'll see me reference this angle of the jaw here. So I come a little bit underneath it and behind it right here, and that's where you'll get that muscle tension. Okay, you can also work your way back, like you see in the view, angled this way back towards that mastoid process that you have. But what I really want you to focus on here are all the different structures that you'll impact when you start to massage in here. The first one are lymphatics. So notice this. This is the largest lymph node cluster in the neck. So can you see how if this muscle gets a lot of excess tension, it changes fluid flow dynamics here, all right? So you can get clogged at that lymph node cluster. And all the stuff up here will struggle to drain down. All the stuff underneath the chin, this is called submandibular, and submental means chin, gets compromised as well. And you'll see that again when we do the anterior digastric, which is going to be like right there if you see me drawing on this. Okay, so you've got your lymphatics. Now I'm going to take that off. The next thing you're going to have are veins. So look at all those veins. You can influence the internal jugular vein, which sits right here, and then the external jugular vein, because that goes to the external part right here. And you can have an issue with vein flow. So everything from the face, from the scalp, from the back of the head, from inside the brain can have an issue because it can't get past this area of tension. So if you stack on the vein flow and the lymph flow stagnation, then you're going to have some issues, because the lymph always flows down into the veins at the bottom of the neck. All right, so that's veins. Now you have arteries, so that's taking things up to the brain, into the areas that the veins went. And look what you have here. You're going to have the carotid artery, but it's going to branch off and go to the internal carotid and the external carotid. And that's going to supply outside the brain and inside the brain. So that can also have an issue. Now, this is where I want to tell you that you just need to be careful pressing in this region really, really hard or really, really deep, because the blood flow sits there. All right, so go easy. It doesn't take a lot of pressure to make a difference in this region. And you shouldn't be sledgehammering this region with a lot of pressure. That's also why I don't want you to do both sides at the same time, because you can compromise blood flow to your brain. Now you have what? We've done lymphatics, we've done arteries, we've done veins. What do we have next? We have nerves. Now there's a bunch of nerves that sit up and through here. I'm going to try to go over them for you. Nerves. So look at all that nerve cluster. Okay. So the first one you're going to really influence in this region are cranial nerves. Okay. So the cranial nerves come off the brain stem in the back. Let me get this here. In this area here are going to be cranial nerve number 9, which is the glossopharyngeal nerve. That's going to affect things for the tongue and the throat. Then you'll have number 10, which is the vagus nerve, the most important nerve for inflammation in the body. And you're also going to have number 11, which is the accessory nerve that supplies the muscle of your trapezius and the sternocleidomastoid muscle in your neck. And you'll also influence number 12, which is the hypoglossal nerve to your tongue. You're going to get that right up underneath this section here. And because you've learned also in what? The slides that we showed you before, you will impact the innervation to a couple of other nerves. Number 7, here, the facial nerve, because that's going to actually supply that posterior digastric, and cranial nerve number 5, which is the trigeminal nerve, because that's going to supply the anterior digastric. So what I want you to realize is that when you put your finger there and you start moving stuff around, you're going to significantly impact the brain from 5, from 7, from 9, from 10, 11, and 12, and that's a neurological powerhouse. Okay? So that's the posterior digastric. We're going to do the same thing here now for the anterior digastric. All right, now we've got both of them together. So look, this is the anterior digastric going up underneath there to that chin. So if I flip this underneath, you can see when I show you how to rub underneath your chin, that's where you're going to be rubbing with the video coming on up. And wouldn't you know it, things are going to sit up underneath here as well. What do you think is going to sit up underneath there? Lymphatics, like we told you before. The submental at the chin and submandibular, and those will drain everything in the mouth and the tongue, and they're really big for brain drainage. Okay. Then you're also going to have your veins underneath there. Look at that. Look how cool that is. Just amazing. Take a look at that. And then the arteries, same thing. Look, what I want you to see is that you see these. Where do these go? They're going back to these, and then these go down. So if you're already stuck at this guy back here, then this guy in front can't get back to that guy there. And then this will struggle to go down to here. And then what if you're blocked down at the bottom? Well, then you're going to be a hot mess in the bottom, behind the jaw, and the chin. That's why you do our big 6 lymphatic reset, right? And then, of course, you got your nerves. Now, the one set of the nerves that I didn't mention up there is what's called the put the acronym here, superior cervical ganglion. So superior just means up, cervical is neck, ganglion is a gathering of nerves. That is a sympathetic nerve fiber plexus that's right here. That's going to give the input to the controlling the blood flow and lymph flow. Where? All up in here. All right. So what's the takeaway? This is not just a simple muscle that you're rubbing. It's one of the most powerful things we're ever going to do to help change your body beyond just the physical pain that you're feeling. All right, let's go over the location of the digastric muscle. I'm going to be showing you the right one, but remember you have 2 of them, and I always want you to work both sides. If you remember, you have a posterior belly and you have an anterior belly. The posterior belly is going to start from the mastoid process. Find your earlobe, go below the ear, put your finger right there as a big bump. That's the mastoid process. Mastoid process on the right, mastoid process on the left. That posterior belly will go from that mastoid process forward, following that jawline towards the hyoid bone that sits underneath the mandible right here. That's the floating bone. The posterior belly goes towards there. The anterior belly will go from the hyoid to the chin like this. That's the anterior belly of the digastric. So when that muscle gets really tense or tight, you'll feel a lot of tension underneath this jaw line here, chin in the front for the anterior belly, and then underneath the mandible and angle of the jaw back this way towards the posterior belly. Now, if you remember the actions of this muscle, it will depress, which means like open the mandible, right? So that's the biggest thing that it does, and it's going to help elevate that hyoid bone, lift it up. So it has a lot to do with the motion of swallowing, because the hyoid bone is going to change when you swallow. Now let's just look at the orientation of the muscle. If it goes from here towards the hyoid bone, now imagine this line is the muscle. If I lengthen this like this, if I wanted to lengthen this tube and lengthen that muscle, I would protrude my chin. You see that? So going forward like this. Now, if I wanted to shorten this or contract that digastric muscle, I would pull my chin backwards. That's called retraction, like this. So one of the things that this helps do is kind of pull the chin back this way as opposed to here. All right. Now think of the other part from the hyoid bone going forward here. If I wanted to lengthen that anterior part, I would also what? Jut out the chin. If I wanted to shorten it or contract that muscle, I would pull the chin back. I would retract this way. right? So that's why this muscle very often can be stretched long and be tight and tense because people have a forward head carriage, they round the shoulders, the mouth is open like this, and then that muscle can get elongated just from here. But what can happen is that the body will try to keep the jaw from going forward to pull it back to be more centered so it can contract that digastric muscle. So the digastric muscle can be always tense and tight. And when things are always tense and tight like that, one of the things that we teach people is that tight tissue does not accept blood flow well. I'll say that one more time. Tight tissue does not accept blood flow well. And when you can't get blood flow up under this region, then you can get inflammation and pain. Right? All these different symptoms that you can have in here when that muscle gets too tight, not enough blood flow, pain in the side of the neck here can go up and towards that jawline region. You can also have it in the ear, back of the head, difficulty swallowing in here, earaches you can experience. I mean, there's a lot of different things that can happen when this muscle is an issue. You'll likely definitely have TMJ type issues, jaw pain. So we'll show you where we want you to rub underneath here to release some of the tension. Just remember the golden rule. Don't cause too much pain when you release these muscles. What I mean by too much is that it can be uncomfortable when you start to massage these muscles and break up tightness or tension in there, and that's okay. But the discomfort or pain should begin to ease up the more you work it. You do not have to sledgehammer yourself and crush this and do the pain is weakness leaving the body kind of stuff. That is not going to work out well for you when you're digging around in this area. And I think you'll notice some nice changes when you begin to do it. So let me show you how you massage these out and try to do these every single day for 2 to 3 weeks. That's a good ballpark to go. See what happens. We're going to do the anterior belly first because it's usually the easiest one. I'm going to show you one at a time, but you can easily do two. I'll show you how to do each one, then we'll do two together. You've got your chin right here. Take your thumb, put it on your chin, and just slide backwards right till you fall up underneath. This is your hyoid bone right here. Massage like this underneath the jawline, working your way straight back towards the hyoid. Stay off of the throat. And then right there is my hyoid bone. Boom, I'm on it. Worked out a little bit like that. See? I can do the same thing on the other side. This one's a little tighter. You may notice that. Ooh, that's really tight right there. Oh yeah, that's a good one. Okay. And just massage. If you like, you can do two together like this. Remember that muscle will pull the jaw down like that, right? Depress it, like this. So if you keep your mouth closed, you can relax it. If you open, it contracts. Just like that. Oh, man, that already feels good. Holy cow. Right? Now, the posterior belly, remember the target is that mastoid process. Okay? And then you have that angle of the jaw. Let me put the thing here and show you. Like this, going towards the hyoid bone, like that. One of the ways that I find this muscle is I have people actually protrude their jaw. And it stretches that muscle. And you can actually feel it pop out a little bit. When you do that, it's a nice way to find it. I just want you to remember that angle right here. What I like to do is find that angle of the jaw right here. Come down right underneath the angle of the jaw. Protrude your chin forward. And then there it is. Just like that. That's the muscle. And massage here from that hyoid bone, working back. You can relax this now that you found it, towards that mastoid. Right there. Ah, yeah, that's it. Just remember that line. That's good. Now I'm going to relax it. And I'm anticipating my left one is going to hurt a little more because my left anterior was on fire, basically. And my posterior is probably going to be tight. Yeah, I can tell you that already. So there's the angle of the jaw right here. I'm going to go from that angle of the jaw down just a little bit, then protrude. There it is. And now go back from the angle of the jaw towards the mastoid. Ah, yeah, that's it. Oh, I was right. Oh, Nelly. Okay, remember what I said? If it really hurts, yeah, that means you need it, but you have to back off and ease it open. Ease it open. Okay. So I'm going to protrude, retract a little bit, protrude, retract a little bit. Right there. Okay. And relax. Move your jaw around a little bit. Man, that feels really good. You may actually notice that you can move different in your head, in your head and your neck when you're moving it around in different directions. You may feel that discomfort there for a little bit after you work that. It's a pretty sensitive muscle. So I want you to move into this easy. I'd rather you repeat this a couple of times a day for a short duration than jumping in there and going too hard, too fast, too deep on the first one when you get there. Okay, you don't have to press in really hard on this one. You go light. Trust me, you'll start to move that muscle. You'll work the fascia, which will move that muscle in that region as well. And notice what kind of just differences that you have in the symptoms that we mentioned to you before. We hope this helps you feel a little bit better. As always, thank you so much for tuning on in. And thank you so much for watching the video. We hope it helped you feel a little bit better. Thank you so much for tuning into our videos and the comments and for subscribing. We really do appreciate it. We love sharing this information with you, and we hope you find value in it. This is Dr. Perry. We'll see you soon on the next video. Bye.